And now the money. Herbs for mental health. Nervines and adaptogens. These are the things that help your body reduce stress. Adaptogens do that. They reduce oxidative stress. They reduce stress on your body. They reduce stress on your organs. And I'm going to make a very broad statement, system. They reduce stress. And they do that to make other herbs more effective when you take them. So we talked about yesterday, when we talked about a lot of herbs for pain relief work best in combination with other things. Valerian works great, but it works better with passion flower and lemon balm. Ashwagandha is an adaptogen. It works great on its own, but it works really great with other herbs, and it's an adaptogen for some of these others. But so ashwagandha, passion flower, lemon balm. If you don't get into the hard stuff like valerian, and valerian's not hard stuff, but it's harder than these types of things, that's all you need. A tea, something you can tincture. These are things that you can tincture. Ashwagandha, passion flower, lemon balm, if you put it in a jar at whatever proportions you want based on the effects that you're looking to get, and you top it off with alcohol and let it sit for 6 weeks, or if you top it off with vinegar and let it sit for 6 weeks, or if you top it off with glycerin and let it sit for 6 to 8 weeks. The difference between the three are effectiveness. Glycerins are not terribly effective, but they do work if you were really eschewing alcohol. Vinegar is the second stage of tinctures that work really well, but they also have an expiration date. Alcohol is the most effective way to tincture, and it has an almost indefinite storage rate. So, I would say for most men don't want to sit down and enjoy a cup of tea. Most men don't. I don't even want to half the time. So, I tincture a lot. And so, for me, my tinctures, if it's a calm down, it's a dropper full in water before I go to bed, or if it's my health tinctures, my multivitamin, my cardiac, my blood sugar. One, like I said, half my family's diabetic, half have heart disease, so I combine all those. I put them in a glass, I put a little water in it, shoot it, have a teaspoon of elderberry syrup, or I enjoy drinking in the morning to wash that, because tinctures don't taste good. It's over and done with, and I think that's the effective way for us as busy people to manage adding new things into our life. Tea takes 20 minutes. Tinctures take 30 seconds. So once you make them, once you strain them off, it's 30 seconds to get your tinctures in and done versus 10 minutes making a cup of tea. On the next page, there is a calm down tea recipe that is available to you should you want the recipe in a more full capacity. That presentation is available to you via your email address when you give it to me. Joint and muscle health. This is also a big one. You're an active person. You like to get outside and build and do that type of thing. And people who like to be active, people who like to exercise, people who want to live long need strong bones and strong joints and strong muscles. You cannot have an expectation that you're going to wake up at 60 and have health for the rest of your life. It is a misnomer that you can just trash your body the first half of your life and be okay the rest of it. I want to live a long time, but I will trade living a very long time for being healthy for the time that I'm alive. And you have to be strong in order to do that. If I don't live to 100, which I'm going to just out of spite, that's okay. But I don't want to be sick, and I don't want to be weak if in my older age. If I'm going at 85 or I'm going at 90, I want to be reasonably healthy until I go. But being sick and confined is not my idea of living. I don't think that that's of value. Just breathing in and out is not value enough for me. But that's me and not you. And in the transcript of this conversation and according to my lawyers, it's simply my opinion. So, but how do you get there? How do you, A, achieve strength? And how do you maintain strength without hurting yourself? So again, you can go to the gym all day long, but you are likely going to have a sports injury or something like that, which will then prevent you from continuing to exercise. So the objective is to slowly build and, or if you have it today, maintain vitality and strength without straining yourself. And as I approach the end of my middle age, it becomes significantly more important to me to maintain that and to, I call it safeguarding my old age. I want to safeguard my health for my old age. So common complaints in that area are back pain, arthritis, and muscle tension. The key drivers in that, some statistics, prevalence, 74 to 80% of men, so that's a lot of them, experience back pain at some point in their lives. That's according to the National Institutes of Health study a couple of years ago, like 2 years ago. And then men aged 35 to 55 are at highest risk. So I'm in that bell curve. Most of us are. More than likely it's due to occupational hazards. People are physical. A nurse up until a year or so ago, that's a very physical job, of likely to get injured by doing it. Gardening is a physical job. I do a lot of it. Men tend to have much more physical jobs, tend to. And also because of our lifestyles, and I hate that word, but lifestyles of activity and all the wonderful fun things of toxic masculinity, we tend to do more things aggressively. And aggressive nature tends to lead to more injury. Heavy lifting, sedentary work posture. So if you are a weekend warrior and you sit at a desk all day and do nothing, you're more than likely to injure yourself when you're doing something. So according to Harvard Men's Health Watch, regular strength, and that doesn't mean pumping a lot of iron, but it means some weight training, or using weight resistance or body weight resistance, flexibility such as yoga, Pilates, or simple stretching. Focusing on the core, and that is not just your abs. Your core starts just below your shoulders. So moobs, core, belly, core, hips, core, and hamstrings. So your hammies back here. So from your knees to your moobs, core. Those are the things that focusing on strength and flexibility in those areas. And notice I never said anything about leg day or arm and shoulder day. You're naturally probably going to be stronger in those areas because you do a lot of physical activity, but your core is where you're going to suffer, and that is where your strength is built. The next one is arthritis. And about 18% of men over the age of 45 are diagnosed, and then significantly higher numbers are undiagnosed with arthritis. There you go. I have it. I have been diagnosed. I have it really bad in my hands, really bad in my feet, to the point where it's causing tendonitis now. I'm working on it. I do a lot of stretching, a lot of those types of things. And arthritis is rheumatoid arthritis and osteoarthritis are two completely different things. So please know the difference if you don't know the difference. One is an autoimmune disorder and the other is an effect of degeneration of your body. Rheumatoid is an autoimmune disorder, which then deteriorates your body. And then one thing that we don't talk about in that joint pain is men tend to get gout. So gout is a buildup of uric acid in the joints, particularly in the extremities, likely in the feet, a lot in the toes. It sounds gross. Even the word gout sounds disgusting. It's hideously painful. I've never had it, but I have anecdotal information about people that it's so incredibly painful. It's horrible. And there's many reasons why you get it. And you want to know some of them? Alcohol consumption is you're getting a buildup of, yep, right.
It was fresh. Yeah, I got me.
I'm with you. So spondylitis is what it's called, and gout. So men with arthritis report higher rates of activity limitation. So again, if you're hitting that middle age and you're getting arthritis, you're not moving and you're not doing the things, the law of motion is something that's going to stay at rest. And if you're limiting your mobility because you've got painful arthritis, that is a perpetuating thing. You will then degenerate and deteriorate to the point of not being able to be moving and not being able to enjoy your life. Omega-3 fatty acids, turmeric, and maintaining a healthy body weight, did not say skinny, did not say swole, did not say ripped, didn't say any of it. And a healthy body weight for you is different than a healthy body weight for you, and a different healthy body weight for me. So there's a vast network of education around nutrition, which is also wildly individual. People talk about recommended daily values of things, recommended daily values of vitamins and minerals and everything else like that. It's a bell curve situation again. They've decided that within this range is what you need. That is not necessarily based on the lifestyle factors that you have, and your body composition and your genetic makeup does not dictate to be within a bell curve. It dictates you as an individual having unique nutritional needs. You as an individual having unique motion and weight needs. They're just different. And I say that with an encouraging and an empowering note, but I know it sounds like, holy crap, how am I supposed to understand what mine is? That is challenging. I will say that functional, and this is my only shill for somebody else today, is I like him and then I hate him. Not hate, hate's a strong word, but dislike sometimes. Dr. Mark Hyman, you've seen him on the internet everywhere. He talks about functional health. He runs a company called, what they do is they take, it's around $400 a year, so it sounds expensive, but it's not when you think about all the other medical things that you're spending money on, about $400 a year. You get and when I say a comprehensive blood test, it's not your lipid values, it's not X, Y, and Z where you get that small little panel of stuff that you got at the doctor's office. It's full. It's lipids, it's cholesterol, it's your vitamin levels, it's your mineral levels to detail. Now, the downside to that is it's expensive. You can't really get it through your doctor because insurance usually won't cover it, and your doctor likely won't prescribe it. And unless a doctor prescribes you going to do it, if you go and ask to go to a lab and get that done, thousands and thousands of dollars. Going through something like Function Health, at a discounted cost, you can get that information. That's the downside of it's not available to everybody yet. It is available to people who can afford it. And the other downside is it's a snapshot in time of what was going on in your day that day. It's going to identify significant deficiencies, not everyday limitations to what you have. But at least it's information that you can start making smarter decisions on. For mobility, for changing up your diet, for supplementing, if your body needs it. So I don't like the idea of taking vitamins, minerals, or supplements willy-nilly, because in the absence of deficiency, there is zero effectiveness or necessity for supplementation. So if your body has enough magnesium, if your body has enough vitamin K, if your body has enough vitamin A, or vitamin B in particular, you are going to do nothing but create expensive pee and expensive poop. And if you take supplements in pill form, you are making, particularly mineral supplementation, you are making really expensive, ineffective poop. Because your body does not recognize synthesized magnesium or iron or anything else like that. It says, oh, look, that's interesting, that's a rock, or that's metal. Great, poop it out. And that doesn't bypass digestion. Pills and tablets do not bypass digestion. Your body has to digest it before it can try to absorb it. And in the absence of deficiency, it doesn't store it. The body takes it in, uses it, and then you represent, because it has an anticipation that you're going to be replenishing it because you eat every day, and you drink every day, and you do that. So your body has an expectation that it doesn't have to store vitamin B12 in your fat. Anyway, that was the sidebar on nutrition, because that's been my focus for the last year or so, and it's been crazy funny. So muscle tension, these are key drivers. Muscle tension is a key driver into injury. We hold our stress tight. We're not loose. Physically demanding jobs, high stress professions, nursing, law, construction, anything that you do for a living is going to cause you stress, and that you're holding in your shoulders and you're holding in your muscles. Chronic stress and lack of stretching in sports, in anything else, is without proper recovery is the key driver to muscle strain and tension. According to a 2021 review in the Journal of Strength, men often exhibit higher baseline muscle tone and greater tension retention post-exercise than women. So when you're a woman, you're exercising, you tend to, once you're finished exercising, relaxing. You're getting recovery after you exercise. Men don't recover. They continue that strain. So a lot of it is the stress. So you're not releasing stress by doing strong strength exercising or going hard at the gym. You are, in fact, creating more tension in your body. So I would normally talk about herbs, but instead I'm going to talk about product. They're herbs, but I have them available. I keep a product on it. It's one of my best sellers, and it's a sore muscle and joint balm without menthol, without all the crap that Ben Gay has, because nobody really wants to go around smelling like that. And so some anti-inflammatory herbs you can get in that salve, or you can create your own, or you can do whatever, are turmeric. Topically, turmeric is probably, I would say, more effective than internal, because you can get it in the dosage, you can get it in a higher dosage, and it can be locally effective versus then trying to put it in your body, because too much turmeric starts to be anti-effective. It doesn't work as well. And it can have toxifying effects on your liver. Cat skull is amazing for both osteo and rheumatoid arthritis. So it helps relieve that inflammation specifically targeted at arthritic tension. Comfrey, amazing, particularly post-workout. If you are sore because you've sustained an injury or workout, comfrey is what we used to call in the old world knit bone. It literally knits your tissues back together. So it heals surgical wounds, it heals that muscle tear, so it gets into your bloodstream, gets into the muscle even locally, and helps restore those tissues. And that joint balm is something that you can purchase very easily. Or you could learn to make your own. I'm okay with that. How are we on time? Anybody? My phone is somewhere.
3:49.
So we're still in pretty good place. We were starting 2:30 to 4, so we've got 10 more minutes. Whatever we get through, we'll get through. If not, I can always have a conversation with you after. Prostate. Big deal for people my age and yours. Prostate growth is common. So as we age, so who knows what the prostate gland is, where it is, how it is? Everybody? So it's part of your reproductive system. It's also part of your urinary tract. It's all of those things. It's a gland that surrounds your urethra and seminal vessels and things like that. And it controls urine flow from the bladder. It controls sometimes incontinence or continence in the back. It controls ejaculate. It also produces some of the fluid in ejaculate. And it is something that as we age, it is common for it to grow and get bigger, which is why you end up with more levels of incontinence and both urinary as well as stool incontinence in older men. It's also probably one of the targeted areas because of the weakness of the gland itself that it's targeted more for cancer in men. But there are ways, but to have it, and it also can contribute to erectile dysfunction, that growth. So it's not uncommon. It shouldn't be something that is not talked about. So we're going to talk about it. And if anybody's embarrassed by it, don't be, because every man has one. It's like the thing about everybody poops. Every man has a prostate gland. And 99% or most men are going to have some experience problems with it as they age. It is the great leveler of us all. So to learn about it, to talk about it, and not be like weird about it is something that we should do and talk about it. Women should talk about breast health and vaginal health and uterine health and all of those things. Men should talk about prostate health. Be really open about it, and who cares? Because nobody does. Prostate growth or benign prostatic hyperplasia is a normal part of aging. And most men by the age of 50, half of them experience it. And the number climbs to nearly 90% by age 80. So if you crested 50, you're 90% likely to have some level of prostate growth. Now, that doesn't mean you're going to get prostate cancer. That means you're going to have prostate growth. It's benign. It doesn't mean it's cancerous. It just means it's inconvenient and can lead to inconveniences down the line. So some of the symptoms, it's not cancer. It can cause bothersome symptoms like frequent urination. So getting up in the middle of the night to have a wee, or weak urine streams. So when we're younger, we pee like racehorses. It's like whoosh. It's like the floodgates open and we're good. As you get older, that floodgate returns to a river, to a stream, to a trickle, to barely a crick and nothing. So that happens because of the prostate growing and swelling. It prevents evacuation, which leads to all those fun commercials on daytime television for having catheters. Don't want those. But it's manageable with the right steps. Regular exercise, talking about exercise again. Talking about diet, lycopene, zinc, those essential minerals and compounds, lycopene, tomatoes, carrots. And herbal supports like saw palmetto. Medical treatments, simple procedures for much more severe things they're easy interventions. Yes, they're interventions, but they're easy interventions to maintain your prostate health for the rest of your life. Now, if anybody is embarrassed by this, you're going to be. Regular ejaculation is a holistic measure to maintain prostate health. Have more sex. Regular ejaculation. Now, that either means with a friend or by yourself. So, masturbation is a great thing. Sex with another person, super great. Regular ejaculation exercises and stimulates the prostate, keeping it from swelling and keeping it from becoming growth. Regular ejaculation plays a beneficial role in prostate health, and it helps clear the prostate of fluid buildup. So that's also great. And you get a second benefit that it's stress relieving. Masturbation, sex, stress relieving. So you're lowering your cortisol levels. So get to it. Have fun. It's great. You're welcome. Note taken, right? And here's the one you're not going to like. Lower dairy and red meat. I enjoy a steak every once in a while. Do not misunderstand me. We eliminated red meat from our diet for a good number of years after my husband's colon cancer diagnosis, because red meat, beef, even if it's organic, even if it's grass-fed, is the highest number counter points for colon cancer that there is something that you can consume. The highest. Pork is the next. Chicken is the next. And then everything goes super low. Fish, super low. Vegetables, super low. And dairy is another one. And I love cheese. Do not get between me and a bit of gorgonzola. It's not going to work out well for you. But it's moderation. It's actually minimization of it. So do less of it than you do anything else. And that will help in prostate health. Simply because of the saturated fats from meat and the calcium from dairy show an increased risk in prostate cancer and benign prostate growth. So there are some herbs that will help prostate health, and we'll go through them really quick. And one you probably already know, which is saw palmetto. It's a berry. It reduces the swelling and it supports urinary health. So a lot of times when people are given medications for prostate health, it is designed to shrink the prostate, and it's also designed to increase the urine flow. So it's going to provide a stimulant for urine flow and something to reduce it. Sometimes that is a synthesized form of saw palmetto, but the natural form is better. Second thing is nettles, both leaf and I say nettle root because it's more prevalent, but any part of nettles is something that reduces prostate inflammation.